Hello everybody, Dr. Raul Rodriguez here with Rodriguez Rejuvenation. Today we're going to talk a little bit about glutathione IVs. Now, a lot of people are familiar, have heard about glutathione as a way to lighten skin color or to smooth out skin coloration if you have dark blotches, etc. But what a lot of people don't realize is that glutathione is the main antioxidant in the human body. Vitamin C is also a very potent antioxidant, and when those two are given in combination as an IV, the main function that it has, it boosts your immune system. It makes your immune system stronger against COVID, flu viruses, and any other types of infections. And it also helps with cellular repair throughout the entire body. The evening out of skin color is the process that takes place over many months. It's a slow process, but the benefits that you get with each IV are immediate in terms of boosting your immune system. The way that we do it is very simple. I've prepped the skin here with a little bit of alcohol. Our patient here today has a very nice vein. We like to use a very tiny little needle, like so. It's much smaller than what's normally used for IVs because these don't hurt. And we just simply insert it into the vein, like so. We put a little piece of tape to hold the little butterfly IV in place. And taking this off, so you see the blood coming back, so it's in good position. And then we start the infusion. I prefer to give the infusion as an IV push for a couple of reasons. Number one, it's quick and simple. You don't have to sit there plugged up to an IV for half an hour waiting for the fluid to go in. So it gets the patient in and out, so we're very respectful of your time. But more importantly, glutathione is very light sensitive. So if you have it sitting up in an IV, up under the fluorescent lights for 30 minutes, you're not getting your full dose of the medication. So this way, you see the medicine going into the vein. This process is very simple. It's totally painless, and the infusion will take about 5 minutes or so. Okay, we are almost done with our IV. You can see there's only a little small amount left here. We finish infusing this little remaining amount. Once again, this is a totally painless procedure. There's no stinging, there's no burning, just a cold sensation of the medication going up the arm. We take this tiny little IV out, and then we hold pressure on that spot, like so, for a few minutes. Now, here's your tip of the day, folks. I'm going to give you a little happy hint. I like to hold pressure right here because I know exactly where the needle went into the vein. Whenever you get your blood drawn in the lab, there's two holes. There's a hole in the skin, and then there's a hole in the vein. By holding pressure like this firmly, you cut off the blood flow to that vein and allow a clot to form. That way you don't have bruising. If you ever had your blood drawn in a lab, when they use those big needles, they just slap a Band-Aid on you and send you on your way. All the Band-Aid does, it covers up the blood coming out of the skin, but there's still blood coming out of that big needle hole in the vein. So when you get home, you look at your arm, and now your arm is all bruised up. If you just simply do what I'm doing here right now, just holding pressure on the vein for a couple of minutes, most people with normal clotting will form a little clot after 2 minutes. Then that way you have a minimal chance of having a bruise when you have your blood drawn. For the IV glutathione, since our patients come in on a regular basis, either for skin lightening or for preventing infection or boosting their immune system, we want to make sure we take good care of the little veins so we can use them over and over again. So that's it for today. Glutathione IV, the benefits, primarily boosting your immune system, but also it can be a useful tool over time to help even out skin color.